It was interesting when we started, probably by virtue of being on this border, as well as my own background of having traveled in Latin America, focused my undergrad studies on Latin America. I thought that we would be seeing mostly people from Latin America as clients. And now we've seen people from more than 90 countries, speaking more than 60 languages. So people certainly have come to us who originate from Latin America. But over the years, we've seen far more people coming originally from Africa and the Middle East, also right now more from Eastern Europe, who are fleeing and looking for safety. And those people on average travel through about 10 countries on average to finally get to this border. And these very, very expensive, arduous, dangerous trips cannot be overstated. Now, many of them, they fly to places where it's easier to get a visa, maybe in Ecuador or elsewhere. And then they go through the Darien Gap, which is a no man's land where they're preyed upon. And then eventually through Central Mexico and then to the US. So I think one of my learnings in working with people 25 years ago or now is the resiliency of the human spirit and how determined they are and what survivors they are. We started it in 1997. San Diego's an interesting community. I think it's maybe the 7th or 8th largest city in the United States. It has a long history of being a resettlement hub for refugees, starting in about 1975. It's right on the border of Mexico. Tijuana, the San Diego region is several million strong. And the border crossing here is one of the busiest in the world. And so we have a long history of a lot of asylum seekers. I had been around people who were torture survivors, but people don't talk about being a torture survivor. It's a very invisible, marginalized, misunderstood group of people. And so the more I became aware of the need, the more it was obvious that there just needed to be a torture treatment program in San Diego. So I asked 2 people who I trusted to join me in the effort, and off we were running, never looking back, and just really pleased to have been able to be part of the foundation of an organization that's literally helped thousands of people heal and start to thrive in their new communities. We have what we call a decentralized service delivery model, where we have core staff. Mostly we and work with independent contractors to provide mental health services in their own private practices. So right now there are about 50 clinicians who we contract with to do therapy and evaluations and other services. What we were doing is working hand in glove with the legal community. And so the legal community would make referrals to us. And we realized that they were really good at the services that they were providing, representing asylum seekers in court, but they didn't have much support. The clients didn't have much case management. They didn't have the evaluations. They didn't have therapy. They didn't have medical care, etc. So we decided to complement what the attorneys were doing. So we worked hand in glove with them, worked closely, got referrals from them. It was interesting, just word of mouth. Early on, I'm really grateful for the mentoring that I received personally and my staff received from other torture treatment programs in the United States, such as PTV in Los Angeles, CBT in Minnesota, and others. And in part of that mentoring was introducing us to IRCT. And so we embraced the National Consortium of Torture Treatment Programs idea. In fact, I'm one of the co-founders and was one of the founding officers of NCTTP in the United States, and certainly embraced the IRCT. And I would not have been able to have done this work initially without those strong mentors. And in turn, we like to mentor others as well, because we know what it's like to start from scratch or to struggle or to feel alone doing this work. And I think we do much better as a field when we support each other. The clients do better as a result of our sharing best practices, sharing our data, doing policy work together. Everybody does so much better when we share that kind of information amongst ourselves and then in turn with the greater community. So I'm really pleased to be part of IRCT. I think it's critical to have that kind of organization globally. So we receive government funding through the Torture Victims Relief Act. And also we receive funding from our local county, and that's specifically for behavioral health. We receive funding from the state of California, also from the United Nations, private foundations, churches, and individuals. And it's the individuals that I get most excited about because they're people in the community who get it. And they say, I want to support torture survivors. I want to support your mission. I want to be welcoming. The big trends is, well, at least what sticks out in my mind is that when we started in the 1990s and we would talk about torture treatment, there were an awful lot of people who just did not believe that torture existed. That there was a lot of disbelief that it was as prevalent as it was and still is. That there were torture survivors who actually did survive and get to the United States. There was just a lot of distancing and dismissing of torture treatment. And then here in the United States, as we know, 9/11 happened in 2001. And on the front page of Time magazine and other ways that news was disseminated, people started learning about torture and actually U.S. participation in torture. And now the conversation had shifted from, is there torture? Does it still exist? To, maybe torture is okay. Maybe there are times when it's justified. And I didn't think that I would ever see that day when we would be having those conversations of saying, no, absolutely, torture is wrong. And the last thing I would say is that we have one of the largest private detention facilities here in San Diego, and it is for immigrants, asylum seekers, Um, Most recently, they've had some large COVID breakouts. So again, conversations I never thought we would be having about torture treatment and where it occurs and how people are treated so poorly. And the people detained, all they've done in this prison-like setting is ask for asylum. Since we're talking about our 25th anniversary here, I think it'll be kind of nice to tell you about our first client number one, who was actually from Latin America, had been tortured. We provided services to him and his family. And his family initially was not with him. They reunified years later here in California, a wife and 4 daughters. And all 4 daughters have gone on to college. The oldest one from Cal Berkeley, all professionals. So here is a relatively simple man from Guatemala who was undereducated, who was targeted by the government there, was brutally tortured, got here and survived as a gardener, was able to not only make himself available to services and benefit from the healing services we had to offer, but then his family as well. So we have this amazing family that's intact and all doing so well, thriving and contributing. I honestly don't think that would have happened without our services. So he did the hard work. He really did. This is not easy work. He's the one that put in the hard work to get better. But what a privilege to accompany him and see this after all these years. So I think we're getting there, but we've got a long ways to go before this is truly an integrated part of our understanding of how to work with torture survivors in the broader society. A lot of our clients say that they want to integrate in families in a healthy way. They want to integrate into their communities in a healthy way. I think we have an obligation to integrate our knowledge into the larger fabric of education and society simultaneously. It can't be just about the torture survivors. It has to be us doing that kind of work too. This has been very challenging work, no doubt about it, and very rewarding, very inspiring work, all of the above. And just when you think that things are settling down, they aren't. There's another crisis in the world, more policy changes, funding goes up and down. It just seemingly is the situation. But it's rewarding work because it goes back to those individual lives where we can and do make a very real difference. And it's heartening, as I just described that story of client number one, to know that we have an impact not just on an individual, but even generations.